Endometrial polyps are abnormal growths that develop in the lining of the uterus, endometrium. These growths can vary in size from small, sesame seed-like structures to larger, golf ball-sized masses. While most endometrial polyps are non-cancerous, benign, some can be precancerous, or even cancerous. Causes and risk factors. The exact cause of endometrial polyps is unknown, but several factors may contribute to their development. Hormonal imbalances. Excessive estrogen levels can promote the growth of endometrial tissue. Age. Women in their 40s and 50s are at a higher risk of developing endometrial polyps. Menopause. Hormonal changes during and after menopause can contribute to polyp formation. Obesity. Excess weight can increase the risk of endometrial polyps. Tamoxifen, this medication, used to treat breast cancer, can raise the risk of endometrial polyps. Family history. A family history of endometrial polyps or certain genetic conditions may increase susceptibility. Symptoms and signs. Many women with endometrial polyps experience no symptoms. However, when symptoms do occur, they may include abnormal bleeding. This can manifest as heavy or irregular periods, bleeding between periods, or postmenopausal bleeding. Pelvic pain or discomfort. Some women may experience cramps or a feeling of fullness in the pelvis. Infertility. In some cases, endometrial polyps can interfere with fertility. Diagnosis. If you are experiencing symptoms that suggest endometrial polyps, your healthcare provider will likely conduct a physical examination and inquire about your medical history. To confirm the diagnosis, one or more of the following tests may be necessary. Transvaginal ultrasound. This imaging technique uses sound waves to create images of the uterus and ovaries. Hysteroscopy. A thin, lighted tube with a camera is inserted through the vagina and cervix to examine the inside of the uterus. Endometrial biopsy. A small sample of tissue is taken from the lining of the uterus for examination under a microscope. Treatment options. The treatment for endometrial polyps depends on several factors, including the size, number, and symptoms associated with the polyps. Many women with small, asymptomatic polyps require no treatment. However, larger polyps or those causing symptoms may require intervention. Observation. Small, asymptomatic polyps may be monitored over time to see if they grow or cause problems. Medication. Hormonal therapy may be used to shrink or prevent the growth of polyps. Surgical removal. Larger polyps or those causing symptoms may need to be surgically removed. This can be done through hysteroscopy or by laparoscopy, a minimally invasive surgical procedure. Prevention. While there is no guaranteed way to prevent endometrial polyps, maintaining a healthy lifestyle can help reduce your risk. This includes maintaining a healthy weight. Obesity is a risk factor for endometrial polyps. Regular exercise. Physical activity can help regulate hormones and reduce the risk of certain health conditions. Healthy diet. Eating a balanced diet rich in fruits, vegetables, and whole grains can support overall health. Hormone therapy. If you are taking hormone therapy, discuss the risks and benefits with your healthcare provider. If you are concerned about endometrial polyps or are experiencing symptoms, it is important to consult with your healthcare provider for evaluation and appropriate treatment.